The cost of health insurance for people and families who use Covered California for their plans may be going up significantly in the new year as federal tax credits, which helped lower those costs, expire. What's your biggest concern about these subsidies not being renewed at this point?
My biggest concern is I've seen the impact, right? I have seen that these enhanced tax credits don't just make health insurance more affordable to people that already have it, though that's a pretty good thing to do also. They have gotten people covered who previously could not afford coverage or health care at all.
Just under 2 million Californians use Covered California for health insurance. 110,000 are in Sacramento County alone.
For some consumers, we're talking about hundreds of dollars more a month, particularly those middle income consumers who could lose their tax credits altogether if Congress continues to fail to extend these tax credits.
Executive Director Jessica Altman encouraged enrollees to understand their individual circumstances, to consider plans that may be less expensive on a monthly basis but have a higher deductible, and to talk to an enrollment specialist about your situation. Cassandra Morales of Port City Insurance shared this example.
Their income hasn't changed from last year to this year, and their premium alone doubled. So they were paying roughly about $350 a month for a family of three. Now going into 2026, their payments jumped up to about $750 a month.
She says if you're concerned about cost of premiums going up, talk to an expert about your expectations of your plan in the new year.
Just from having a really transparent conversation, we were able to drop her plans from the silver plan to the bronze plan and find out that there's not going to be too much of a difference on the bills that she's seeing, but on a monthly premium basis, she's going to be saving about $300 a month now. So that alone really, I feel like, helped her feel more confident going into 2026.
Covered California's open enrollment period goes through January 31st, but enrollees need to have plans selected by New Year's Eve to ensure they have coverage for January. Leanne Denyer, KCRA 3 News.
Now, Altman says that with the enhanced tax credit being unavailable, there are still tax credits. The state also has some funding to help alleviate the increased cost, but says that it won't make up what she described as the hole in the federal government that is being left behind.